Hello guys, how are you? I hope so that you will be fine and enjoying good health. Today's I have topic on diabetic neuropathy. So let's discuss what it is. As you know, diabetic neuropathy is a type of nerve damage that can occur if you have diabetes. High blood sugar glucose can injure nerves throughout the body. Diabetic neuropathy most often damages nerves in the legs and feet. Depending on the affected nerves, diabetic neuropathy symptoms include pain and numbness in the legs, feet, and hands. It can also cause problems with the digestive system, urinary tract, blood vessels, and heart. Some people have mild symptoms, but for others, diabetic neuropathy can be quite painful and disabling. Diabetic neuropathy is a serious diabetes complication that may affect as many as 50% of people with diabetes, but you can often prevent diabetic neuropathy or slow its progress with consistent blood sugar management and a healthy lifestyle. What are the symptoms? There are four main types of diabetic neuropathy. You can have one type or more than one type of neuropathy. Your symptoms depend on the type you have, which nerves are affected. Usually symptoms develop gradually. You may not notice anything is wrong until desirable nerve damage has occurred. And peripheral neuropathy, what is peripheral neuropathy? This type of neuropathy may also be called a distal symmetric peripheral neuropathy. It's the most common type of diabetic neuropathy. It affects the feet and legs first, followed by the hands and arms. Signs and symptoms of peripheral neuropathy are often worse at night and may include numbness or reduced ability to feel pain or temperature changes and tingling or burning feeling and sharp pains or cramps and muscle weakness, extreme sensitivity to touch. For some people, even a bed sheet's weight can be painful, and serious food problems such as ulcers, infections, and bone and joint damage. Autonomic neuropathy. What is autonomic neuropathy? The autonomic nervous system controls blood pressure, heart rate, sweatings, eye, bladder, digestive system, and sex organs. Diabetes can affect nerves in any of these areas, possibly causing the signs and symptoms including lack of awareness that blood sugar levels are low, hypoglycemia, unawareness, drops in blood pressure when rising from sitting or lying down that may cause dizziness or fainting, orthostatic hypotension, bladder or bowel problems, slow stomach emptying, gastroparesis causing nausea, vomiting, sensation of fullness, and loss of appetite, difficulty in swallowing, changes in the way the eyes adjust from light to dark or far to near, and increased or decreased sweating, problems with sexual response such as vaginal dryness in women and erectile dysfunction in men. Then there is proximal neuropathy, diabetic polyradiculopathy. This type of neuropathy often affects nerves in the thighs, hips, buttocks, or legs. It can also affect the abdominal and chest area. Symptoms are usually on one side of the body but may spread to the other side. And proximal neuropathy may include severe pain in the buttock, hip, or thigh, weak and shrinking thighs muscles, difficulty rising from a sitting position, chest or abdominal wall pain. Then is the mononeuropathy or focal neuropathy. Mononeuropathy refers to damage to a single specific nerve. The nerve may be in the face, torso, arm, or leg. Mononeuropathy may lead to difficulty focusing or double vision, paralysis on one side of the face, numbness or tingling in the hands or fingers, weaknesses in the hands that may result in dropping things, pain in the shin or foot, and weakness causing difficulty lifting the front part of the foot drop, and pain in the front of the thigh. When to see a doctor? Call your healthcare provider for an appointment if you have a cut or sore or your foot that is infected or will not heal, burning, tingling, weakness or pain in your hands or feet that interferes with daily activities or sleep, changes in digestion, urination or sexual function, dizziness and fainting. American Diabetes Association recommend that screening for diabetes neuropathy begins immediately after someone is diagnosed with type 2 diabetes or 5 years after diagnosis with type 1 diabetes. After that, screening is recommended once a year. Then what are the causes? The exact cause of each type of neuropathy is unknown. Researchers think that over time, uncontrolled high blood sugar damages the nerves and interferes with their ability to send signals leading to diabetic neuropathy. High blood sugar also weakens the walls of the small blood vessel capillaries that supply the nerves with oxygen and nutrients. What are the risk factors? Anyone who has diabetes can develop neuropathy, but these risk factors make nerve damage more likely if poor blood sugar control. Uncontrolled blood sugar increases the risk of every diabetes complication, including nerve damage. And diabetes history, the risk of diabetic neuropathy increases the longer a person has diabetes, especially if blood sugar is not well controlled. Suppose in kidneys disease, diabetes can damage the kidneys. Kidney damage send toxins into the blood which can lead to nerve damage. Being overweight, having a body mass BMI of 25 or more increase the risk of diabetic neuropathy. Then smoking narrows and hardens the arteries, reducing blood flow to the legs and feet, and this makes it more difficult for wounds to heal and damaging the peripheral nerves. What are the complications? Diabetic neuropathy can cause a number of serious complications including hypoglycemia and awareness, blood sugar levels below 70 milligrams per deciliter or 3.9 millimoles per liter. Millimoles per liter usually causes shakiness, sweating, and a fast heartbeat, but people who have autonomic neuropathy may not experience these warning signs. Loss of a foot or leg. Nerve damage can cause a loss of feeling in the foot, so even minor cuts can turn into sores or ulcers without being noticed. In severe cases, an infection can spread to the bone or lead to tissue death. Removal of amputation of a foot or even part of the leg may be necessary. And then urinary tract infection, urinary incontinence. If the nerves that control the bladder are damaged, the bladder may not empty completely while urinating. Bacteria can build up in the bladder and kidneys, causing urinary tract infections. Nerve damage can also affect the ability to feel the need to urinate or to control the muscles that release urine, leading to leakage, incontinence, and sharp drops in the blood pressure. Damage to the nerves that control blood flow can affect the body's ability to adjust the blood pressure. This can cause a sharp drop in the pressure when standing, after sitting, or lying down, which may lead to lightheadedness and fainting. Then digestive problems. If nerve damage occurs in the digestive tract, constipation or diarrhea or both are possible. Diabetes-related nerve damage can lead to gastroparesis, a condition in which the stomach empties too slowly or not at all. This can cause bloating or indigestion. Then sexual dysfunction. Autonomic neuropathy often damages the nerves that affect the sex organs. Males often experience erectile dysfunction. Women may have difficulty with lubrication and arousal or orgasm. Increased or decreased sweat and nerves damage can disrupt how the sweat glands work and make it difficult for the body to control its temperature properly. What is the prevention? You can prevent or delay diabetic neuropathy and its complication by closely managing your blood sugar and taking good care of your feet. The blood sugar management ADA recommend that people living with the diabetes have a glycated hemoglobin test at least twice a year. This test indicates your average blood sugar level for the past 2-3 months. A1C goals may need to be individualized, but for many adults, the ADA recommends an HbA1c of less than 7%. If your blood sugar levels are higher than your goal, you may need changes in your daily management, such as adding or adjusting your medications or changing your diet or physical activity. Then foot care. Foot problems, including sores that do not heal, ulcers, or even amputations, are common complications of diabetic neuropathy, but you can prevent many of these problems by having a thorough foot exam. At least once a year. Also have your healthcare provider check your feet at each office visit and take good care of your feet at home. Follow your healthcare provider's recommendations for good foot care to protect the health of your foot. Check your foot every day. Look for blisters, cuts, bruises, cracked and peeling skin, redness and swelling. Use a mirror or ask a friend or family member to help examine parts of your feet that are hard to see. Keep your feet clean and dry. Wash your feet every day with lukewarm water and mild soap. Don't soak your feet and dry your feet and between your toes thoroughly. Moisturize your feet. This helps prevent cracking, but don't get lotion between your toes because it might encourage fungal growth. Trim your toenails carefully. Cut your toenails straight across. File the edges carefully so that you have smooth edges. If you cannot do this yourself, a specialist in foot problems, podiatrist can help. And wear clean, dry socks. Look for socks made up of cotton or moisture-wicking fibers that don't have tight bands or thick seams. Wear cushioned shoes that fit well. Wear closed shoes or slippers to protect your feet. Make sure your shoes fit properly and allow your toes to move. Foot specialist can teach you how to buy properly fitted shoes and to prevent problems such as corns and calluses. If you qualify for Medicaid, you may plan to cover the cost of at least one pair of shoes each year. And what is the diagnosis and treatment? As far as diagnosis is concerned, your healthcare provider can usually diagnose diabetic neuropathy by performing a physical exam and carefully reviewing your symptoms and medical history. Your healthcare provider typically check your overall muscle strength and tone, tendon reflexes, sensitivity to touch, pain, and temperature and vibrations. Along with the physical exam, your healthcare provider may perform or order specific tests to help diagnose diabetic neuropathy, such as filament testing. A soft nylon fiber monofilament is brushed over areas of your skin to test your sensitivity to touch. Sensory testing, this non-invasive test is used to tell your nerves respond to vibration and changes in temperature. Nerve conduction testing, this test measures how quickly the nerves in your arms and legs conduct electrical signals. Electromyography, called needle testing, this test is often done along with nerve conduction studies. It measures electrical discharges produced in your muscles. Autonomic testing, special tests may be done to determine how your blood pressure changes while you are in different position and whether your sweating is within the standard range. Treatment, diabetic neuropathy has no known cure. The goals of treatment are to slow progression, relieve pain, manage complications, and restore function. Slowing progression of the disease, consistently keeping your blood sugar within your target range is the key to preventing or delaying nerve damage. Good blood sugar management may even improve some of your current symptoms. Your healthcare provider will figure out the best target range for you based on factors including your age, how long you have had diabetes, and your overall health. Blood sugar levels need to be individualized, but in general, the American Diabetes Association recommends the following target sugar levels for most people with diabetes: between 80 to 130 milligram per deciliter, which is 4.4 to 7.2 millimoles per liter before meals, and less than 180 milligram per deciliter, 10 millimoles per liter 2 hours after meals. The ADA generally recommend HbA1cs of 7% or lower for most people with diabetes. And it is highly encouraged that slightly lower blood pressure sugar levels for most younger people with diabetes and slightly higher levels for older people with other medical conditions and who may be more at risk of low blood sugar complications. So generally recommends the following target blood sugar levels before meals: between 80 to 120, which is 4.4 to 6.7 millimole per liter for people aged 59 and younger who have no other medical conditions, and between 100 to 140 milligram per deciliter, which is 5.6 to 7.8 millimole per liter for people aged 60 and older, or for those who have other medical conditions including heart, lung, or kidney disease. Other important ways to help slow or prevent neuropathy from getting worse include keeping your blood sugar under control, maintaining a healthy weight, and getting regular physical activity. Relieving pain, many prescription medications are available for diabetes-related nerve pain, but they don't work for everyone. When considering any medication, talk with your healthcare provider about the benefits and possible side effects to find that might work best for you. And pain relieving prescription treatment may include anti-seizure drugs. Some medication used to treat seizures include epilepsy are also used to ease nerve pain. The ADA recommends starting with pregabalin, Lyrica, gabapentin, Neurontin also is an option. Side effects may include drowsiness, dizziness, and swelling in the hands and feet. Then antidepressants are being used. Some antidepressants ease nerve pain even if you are not depressed. Tricyclic antidepressants may help with mild to moderate nerve pain. Drugs in this class include amitriptyline, nortriptyline, pamilor, and desipramine, norpramine. Side effects can be bothersome and include dry mouth, constipation, drowsiness, and difficulty concentrating. These medications may also cause dizziness when changing positions, such as from lying down to standing, or to static hypotension. Then serotonin and norepinephrine reuptake inhibitors, SNRIs, are another type of antidepressant that may help with the nerve pain and have fewer side effects. The American Diabetic Association recommends duloxetine, Cymbalta as a first treatment. Another that will be used in venlafaxine, FX, or XR. Possible side effects include nausea, sleepiness, dizziness, decreased appetite, and constipation. Sometimes an antidepressant may be combined with an anti-seizure drug. These drugs can also be used with pain-relieving medications, such as medication available without a prescription. For example, you may find relief from acetaminophen, Tylenol, or ibuprofen, Advil, Mortin IB. Others, or a skin patch with lidocaine and a numbing substance. Then managing complication and restoring function. To manage complication, you will need care from different specialists. These may include a specialist to treat urinary tract problems, urologist, and a heart specialist, cardiologist, who may help prevent to treat complications. The treatment you will need depend on the neuropathy related complications you have. Urinary tract problems, some drugs affect bladder function, so your healthcare provider may recommend stopping or changing medication. Strict urination, schedule urinating every few hours, timed urination while applying gentle pressure to the bladder area below your belly button can help some bladder problems. Other methods, including self-catheterization, may be needed to remove urine from a nerve-damaged bladder. And digestive problems, to really mild signs and symptoms of gastroparesis, indigestion, belching, nausea, and vomiting, eating smaller, frequent meals may help. Diet changes and medications may help relieve gastroparesis, diarrhea, constipation, nausea. Then blood pressure on standing orthostatic hypotension. Treatment is start with simple lifestyle changes such as not using alcohol, drinking plenty of water, and changing positions such as from sitting to standing slowly. Sleeping with the head of the bed raised 4 to 6 inches helps prevent high blood pressure overnight. Your healthcare provider may also recommend compression support for your abdominal thighs, abdominal binder, and compression shorts or stockings. Several medications, either alone or together, may be used to treat orthostatic hypotension. Then sexual dysfunction medications may be taken by mouth or injection, may improve sexual function in some men, but they are not safe and effective for everyone, such as testosterone injections. And mechanical vacuum devices may increase blood flow to the penis. Women may benefit from vaginal lubricants. Then lifestyle and home remedies may be helpful. These measures can help you feel better overall and reduce your risk of diabetic neuropathy. Keep your blood pressure under control. If you have high blood pressure and diabetes, you have an even greater risk of complications. Try to keep your blood pressure in the range your healthcare provider recommends, and be sure to have it checked at every office visit. Make healthy food choices. Eat a balanced diet that includes a variety of healthy foods, especially vegetable foods and whole grains, nuts. Limits proportion size to help achieve or maintain a healthy weight. Be active every day. Exercise helps lower blood sugar, improves blood flow, and keeps your heart healthy. Aim for 150 minutes of moderate or 75 minutes of vigorous aerobic activity a week, or a combination of moderate and vigorous exercise. It's also a good idea to take a break from sitting every 30 minutes to get a few quick bursts of activity. Talk with your healthcare provider or physical therapist before you start exercising. If you have decreased feeling in your legs, some types of exercises such as walking may be safer than others. If you have a foot injury or so, stick with exercise that does not require putting weight on your injured foot. Stop smoking. Using tobacco in any form makes you more likely to develop poor circulation in your feet, which can cause problems with healing. If you use tobacco, talk to your healthcare provider about finding ways to quit. Alternative medicines. There are many alternative therapies that may help with pain relief of their own or in combination with medications, but check your healthcare provider before using any alternative therapy or dietary supplement to make sure that you don't have any potential interactions. For diabetic neuropathy, you may want to try capsaicins. Capsaicins creams applied to the skin can reduce pain sensation in some people. Side effects may include a burning feeling and skin irritation. And alpha-lipoic acid, this powerful antioxidant, is found in some foods and may help relieve nerve pain symptoms in some people. Then acetyl-L-carnitine, this nutrient is naturally made in body and is available as a supplement. It may ease nerve pain in some people. Then transcutaneous electrical nerve stimulation, TENS. This prescription therapy may help prevent pain signals from reaching the brain. TENS delivers tiny electrical impulses to specific nerve pathways through a small electrode placed on the skin. Although safe and painless, TENS does not work for everyone or for all types of pain. Then acupuncture may help relieve the pain of neuropathy and generally does not have any side effects. Keep in mind that you may not get immediate relief with acupuncture and might require more than one session. Coping and support with the diabetic neuropathy can sometimes be challenging. Support groups can offer encouragement and advice about living with diabetic neuropathy. Ask your healthcare provider if there are any in your area or for a referral to a therapist. Preparing for your appointment. If you don't already see a specialist in treating metabolic disorder and diabetes endocrinologist, you will likely be referred to one of. If you start showing signs of diabetes complications, you may also be referred to a specialist in brain and nervous system problem neurologist. Be prepared for your appointment. You may want to be aware of pre-appointment restrictions. When you make the appointment, ask if there is anything you need to do in advance, such as restrict your diet. Make a list of any symptoms you are having, including any that may seem unrelated to the reason for the appointment. Make a list of key personal information, including any major stresses or recent life changes. Make a list of all medications, vitamins, herbs, and supplements you are taking and the doses being Bring a record of your recent blood sugar levels if you check them at home. Ask a family member or friend to come with you. It may be difficult to remember everything your healthcare provider tells you during an appointment. Someone who accompanies you may remember something that you missed or forgot. Make a list of questions to ask your healthcare provider. Some basic questions to ask may include: is diabetic neuropathy the most likely cause of my symptoms? Do I need a test to confirm the cause of my symptoms? How do I prepare for these tests? Is this condition temporary or long lasting? If I manage my blood sugar, will these symptoms improve or go away? Are the treatments available, and which do you recommend? What types of side effects can I expect from treatment? I have other health conditions. How can I best manage them together? Are there brochures or other printed material I can take with me? What website do you recommend me for my disease? Do I need to see a certified diabetes care and education specialist, a registered dietitian, or other specialists? What to expect from your doctor? Your healthcare provider is likely to ask you a number of questions such as: how effective is your diabetes management? When did you start having symptoms? Do you always have symptoms, or do they come and go away? How severe are your symptoms? Does anything seem to improve your symptoms? What, if anything, appears to make your symptom worse? What's challenging about managing your diabetes? What might help you manage your diabetes better? So this was all about the diabetes and diabetic neuropathy. I hope so that this information would be more effective for you and more informative for you. If you have liked this video, then kindly share this video with other individuals as well, and don't forget to subscribe my channel. And have a wonderful nice day, and for listening to this video. Thank you very much.